Hi, I am Dr. Susan Wynne, Medical Director of HealthyPlace.com. I am talking to you now about why schizoaffective disorder is so difficult to diagnose. Before I do that, I'd like to define some terms. Schizophrenia. Schizophrenia is a chronic condition with at least two of the following: delusions, which are false fixed beliefs; hallucinations, hearing voices and seeing things; disorganized speech; or catatonic behavior, such as not moving for long periods of time and not being able to take care of oneself; flattened facial expression; lack of motivation. For the majority of the time since symptoms began, there's a disturbance in at least one of the following areas: work, school, interpersonal relationships. So schizophrenia is a chronic condition marked by usually hallucinations and false fixed beliefs. Bipolar disorder, and there are two types of bipolar disorder. I want to talk about those briefly. There's bipolar 1 and bipolar 2. Bipolar disorder usually consists of either a manic or a hypomanic period of time. And mania or hypomania is a discrete episode of elevated mood, so either being very happy or very irritable. For mania is at least 1 week, and the feeling must be sufficiently severe in mania to cause severe impairment in work or school or interpersonal relationships. Hypomania is a lower grade mania, and it usually lasts for at least 4 days or less, and the impairment is less. Let me talk about depression. Depression is an episode of at least 2 weeks with significant symptoms such as sadness, lack of interest, guilt feelings, worthlessness feelings, low energy, poor concentration, changes in appetite, and changes in sleep. Bipolar 1 disorder, during the course of this illness, one would have to have had an episode of mania, which is at least a week of what we talked about, the elevated, expansive, irritable mood, and at least one episode of a major depressive episode, so a serious depression episode. Bipolar 2 disorder consists of depression at some time during the illness and hypomania or low-grade mania. Schizoaffective disorder, and this is the one that's very difficult to differentiate sometimes between bipolar disorder and schizophrenia. There has to be an episode of either a major depressive disorder, a manic episode, or a mixed episode, and that's an episode that has both manic features and depression symptoms. The occurrence of the hallucinations or the delusions must be in the absence of a serious mood symptoms for at least 2 weeks. But the mood disorder must be an ongoing issue in the illness. Generally speaking, the prognosis for bipolar disorder is better than schizoaffective disorder or schizophrenia. And the prognosis for schizoaffective disorder is generally better than schizophrenia, but not as good as bipolar disorder. It is often difficult to differentiate between the illnesses due to overlap in symptoms and changes in an individual's symptoms over time. Schizoaffective disorder has symptoms common to both bipolar disorder and to schizophrenia. Thank you.